Hello and welcome to COVID-19 Local Impact on Your TV. I'm Dan Malta from the Your TV studios in Peterborough, and today is our Feel Good Friday show, meaning no COVID-19 statistics on this episode and no updates from politicians. What we do have is a collection of some feel-good stories from the week that was. May is Better Hearing Month. With many of us wearing masks, those with hearing issues have found it even harder to communicate. Your TV's Mary Tendeshat speaks with audiology expert Andreas Salic to discuss the obstacles and solutions for the hearing impaired.
So a lot of people are in different communication situations in COVID right now. And so one of them, people are at home, and so they're looking to different tools. They're reaching out to, FaceTime and Zoom meetings and things like that, which are fantastic in order to keep people connected. Unfortunately, they can aggravate some of the underlying hearing issues that people have been having. So if people were already having, a little bit of a difficulty, when you add this extra layer of complexity, maybe you're not getting as much acoustic information, maybe the quality of the call isn't as good, maybe the visual cues aren't good because the lighting is poor, or whatever it is, that extra layer of complexity can be the straw that breaks the metaphorical camel's back in terms of communication breakdown. So that's certainly one of the issues. And then the other issue that's been coming up a lot for individuals is mask wearing. So we're seeing a lot of mask wearing for source control, so protecting the individual as well as protecting other people. And the consequence of that is that you're robbing individuals of visual cues. And so we don't realize it, but we're not just hearing with our ears, we're hearing with our brain. And that means that we're not just looking for the sounds that we're hearing, but we're looking for visual cues, be it body language or lip reading. And our brain uses the sum of all of that information in order to understand what's heard. And so with mask wearing, we're taking away a lot of those visual cues. And so again, people that might have been at a disadvantage hearing, we're relying on those visual cues, and you take those away, and that again can make all the difference. So one of the ways we're trying to overcome the issue with losing the visual cues with mask wearing is that we're sourcing masks that have visible pane where the mouth is, and so that's allowing you to preserve some of the visual cues that would have otherwise been lost. And it might not be a perfect solution, but it's a nice compromise in allowing us to keep our staff safe, our patients safe, and still help keep communication the best we can under these circumstances.
Masks are definitely part of our current situation. Going forward, it may be our new reality. If someone would like to obtain a mask that has a clear opening, where would they go about getting that?
So right now, the easiest way to source them is there's a lot of individuals making handmade masks, and that's probably the easiest way for people out in the community to access them. And so whether it's, a local tailor that's, found this as an opportunity to help people out, that's probably the most likely bet, although there are some that are being large scale manufactured. It's just a little bit more difficult for the public to access those.
You also mentioned lighting and how in social media that can be an issue. How are you able to overcome that?
So, with good lighting, we're being conscious of where people are being seated. We want to increase distance, but we also want to keep good lighting on the face. When we're talking to individuals, making sure you're maintaining good eye contact in those kinds of situations, and just being really present and conscious of the communication.
Trent Talks is a show produced by Trent University, airing on Your TV during the COVID-19 pandemic. Chancellor Stephen Stone discusses the topic of emotional wellness in uncertain times on the show's most recent episode. In this excerpt, Dr. Robin Hanley-Defoe explains the 5 key points to self-resiliency.
The work that I've done and my team has done has uncovered that there's essentially 5 core competencies that actually contribute to someone's baseline for resiliency. And I'd take a moment just to share those with you, because I think this gives people context as to anywhere along that theory, you can jump in here to think about what are some strategies and tools that I could use here. So the first and foremost that we've come upon working with people all over the world, and again, everything from first responders to persons in remote communities, all the way to our military, are these ideas that it's important that we have a sense of belonging. We need to know where we belong, where we have voice, where we have that sense of a home team. And that home team is what's going to give us strength. It's going to give us confidence and our capacity to be vulnerable, to be nervous, but trust that it's going to be okay on the other side of it. The second part my program talks about is the importance of perspective. And perspective means it's this capacity to hold a mindset that also takes into consideration how we feel. So it's an alignment between our head and our heart. And sometimes the greatest delta can actually be between our head and our heart, and is actually getting ourselves on the same page. So, right now, a perspective example of COVID-19 could be this idea that we're working from home. But the reality of perspective shift would be that we're at home trying to be part of the solution during a global pandemic, trying to get work done. And when we have that wee bit of a shift of a perspective, all of a sudden it keeps everything in context. The third that we've uncovered in my work is the role of acceptance. And what we mean by this is persons that have a baseline for resiliency know when they can lean into what's within my control. And ultimately, what's in our control are our thoughts and our behaviors, and what's outside of our control, which is essentially everything else. But what we think about is when you come up to a difficult situation, can I persist through it? If I can't persist, can I pivot? Can I switch or adapt? And the third option, if you can't make it through it, we punt it away. We acknowledge that that's not within my control. I'm going to move on. Now, the fourth variable that we talk about in my work is being hope-filled or hopefulness. And I have a really quick story to share with you where we came upon this work that I think people can relate to. And I had an opportunity to work with a group of soldiers when they were coming home after a tour of duty. And I was really curious about, what do you hope for or look forward to the next day when you just came home after a tour? So I was talking to these group of soldiers, and the first one said to me, tomorrow, on his very first day off, he was going to paint the rest of his kitchen. And I thought, wow, all this time and you're going to paint your kitchen. And the next soldier said that he was going to lay down hardwood floor because before he left, he only got half done. I spoke to this entire platoon and they all had house projects, which I thought was so peculiar. So I asked their lieutenant, I said, sir, why did all these soldiers leave half-finished house projects before deployment? And what he shared with me was something that was so transformational to my work. He said, Robin, those soldiers leave those as signs of hope for their families that they're coming home. So every time they come in, they see that half-finished project, they can lean into the belief they're coming home. And the next part was so significant because he said, Doc, hope is a choice. We have to choose to be hope-filled in every situation to be able to be of service to others. So I think about what persons are going through right now, our frontline responders, everything from our cashiers to our medical professionals, and they're doing their job hope-filled. The fifth one and the last one is the role of humor, or finding those pockets of joy or where we can feel lightheartedness. Because if we're only thinking about the big and heavy, we feel overwhelmed. So this is where we lean into those little pockets where we can actually have this experience of joy. And right now, I want to give such a shout out to our artists. Think about how much the artists have contributed to COVID-19 solutions. They're giving us things to watch. They're giving us things to enjoy. All of us are contributing in our own way. So when I think about resiliency, those are 5 areas that we can start to have conversations about.
With the heightened adherence to cleaning surfaces, whether in your home or out in public, people are more aware of the coronavirus being on surfaces. Peterborough-based company AppaSolve is seeing an increase in business due to the pandemic. Your TV's Mary Tendichet speaks with the co-founder of AppaSolve Technology, Natalie Ambler, who says they're able to make the invisible germ visible.
AppaSolve Pathfinder is a technology that detects organic contamination on hard, non-porous surfaces. We're now able to provide images of potential risk in the environment.
Many organizations are already using AppaSolve to detect germ contamination.
We work with organizations like hospitals, long-term care would be some of our healthcare connections. We also, prior to COVID-19, worked a lot in food safety. So that would be a food processing plant. With the emergence of COVID-19, we're seeing a lot more commercial and institutional spaces also be interested in the technology, such as schools, post-secondary education facilities, recreation facilities, and office spaces as well.
Ambler says using their software, they can track data on how clean surfaces are.
This allows some measurements and metrics so that we can do continuous improvement and look at improving outcomes. We also have surface imaging technology, which is our unique proprietary technology. This is the visualization of surface contamination in the environment. When you look at the images, they're intensity maps, and you're going to see the contamination on those surfaces ranging through a color spectrum. The yellow would be a less intense contamination on that surface, orange is going to be high, and then the red on that image is going to be severe contamination on the surface.
Ambler says they are launching a mobile upgrade to their technology, which will provide instant results.
So what this now allows us to do is be on site and give real-time feedback of that contamination on surfaces.
Common surfaces for contamination are door handles, light switches, and IV poles or call buttons in a healthcare facility.
But it's not always the ones that you would think as the most germiest that end up being the most germiest. So, often we'll find that a lot of attention has been paid to a washroom facility for cleaning and disinfection. And sometimes it can be more of those, what we call gray area items, where the responsibility for cleaning and disinfection isn't as clear. In an office space, for example, that might be a computer keyboard or a mouse. As people begin to integrate back into their normal day activities, buildings, offices that are wanting to keep their workers safe, we're also seeing interest from hospitality as well as people get moving back out into their normal travel plans. And then, very similar to what we saw after SARS or MRSA, I also think that the healthcare is going to reflect back and really pose that question of what can we do better next time? People are going to be asking those questions. How do I know this space is clean? How do I know this space is safe? And we feel like our solutions can help provide some assurance to those questions.
As more organizations are forced to cancel major fundraisers, the CCRC has modified its 15-year-old Jukebox Mania event. Normally, the event is held in the Memorial Center with 500 people in attendance. This year's Jukebox Mania Connections will now air on Your TV and online Friday, May 29th, and will feature local musicians and community partners.
Our big fundraiser is Jukebox Mania, which draws in between the participants and the volunteers and the food vendors and everybody who participates. It's usually around 500 people who come to the MEM Center. It's our big fundraiser. That's what generates our fundraising income, most of it for the year, and we had to cancel it, obviously, as most other charities did. We're all kind of in the same situation with, we rely on events to get the word out about our services, to reach people who we maybe haven't reached before, to get our message out that we have these services available, and to generate some income. And that didn't happen. So we have a great committee that's made up of some staff members and volunteers within the community and our board members, and they've been sitting at a table for the last couple of months, a virtual table, trying to figure out what to do. How do we respect some of the businesses who gave us donations for our silent auction that we have in hand, that we aren't having a silent auction at Jukebox. So what do we do with those things? How do we respect those small businesses? Because that's part of what Jukebox is. It's to showcase the great community support that we have from local businesses and from local people. And we had sponsors. We had businesses who were helping us pay offset costs and sponsoring, and that was part of our revenue. And then we, of course, had our participants who we have some who've been coming right from the get-go. This would have been our 15th year of hosting Jukebox. So we've been trying to figure out, like, what do we do? And we had come up with the sort of broadcast thing, trying to find some local musicians who are willing to donate their time and their talent, and also kick off an online auction where we can showcase and we can try and generate some income. So we can showcase items from local businesses who have given us permission to use it in this way, use their items, whatever they've donated, and to also recognize the sponsors who stuck with us. We had some sponsors who said, yeah, we recognize the value in the service that you're doing for the community, and we really want to support that. So it's also a way to have a little bit of entertainment as well. You can watch it on Kojiko, on Your TV. You can watch it on, we'll have a link to the Your TV broadcast on our Facebook page and also on our website.
As COVID-19 local impact continues on Your TV, we'll bring you some more of the feel-good stories from the week, especially the ones from Northumberland County. Welcome back to COVID-19 Local Impact on Your TV. I'm Dan Malta. Last Thursday, the province of Ontario announced we're entering phase 1 of reopening the economy. Included in the announcement, libraries are now able to offer curbside pickup. Cobourg Public Library CEO Tammy Robinson explains to Your TV's Mark Rockburn what the curbside pickup process looks like.
What we've done is Friday and Saturday, we started calling people at home that had their holds that have been waiting since, March and April to get their items. And what the process is, it's contactless. So we try to make it as easy for our patrons and our staff as possible. So what will happen is you receive a phone call from us, and then we let you know that you have an item here for pickup. We have certain hours that we're open for pickup. So today, for instance, we're open 1 to 4, and the next day 10 to 1, and then 1 to 4. So we're alternating between afternoon, morning. When the person comes to the library, they do not need to show us their library card. We decided we would check the items out for them already, so they didn't have to go into their wallet, get their card, pass it over, and so on. Everything is checked out. They will need to stand in line on the sidewalk, which is all marked off. We will have a staff member out in the parking lot. I think it's me today. And you simply give me your last name. I let the person know in the library, who will just be in that little area in the lobby. They will then pass that name to a runner who will grab your bag. The books are already bagged in a paper bag. Set it on a table, staff steps back, you take your bag, and away you go. If you're not able to get out of your car for any accessibility issues, again, I will approach the vehicle, ask their last name, I'll get the bag, and I'll put it in their trunk. So it should be relatively quick, since no one's getting money or cards. It's just, what's your name? Here you go, and off you go.
How can people go about reserving books or getting books out of the library? Still the same process, or?
Still the same process. There's the two ways. You can go onto our website and just go into your account and put whatever you want on hold. Or if you do not have technology or unable to hook into it, then you just call, and we will have someone manning the phones, and we will go and grab those books for you. But because we're doing the backlog right now, it'll take us a few days to get through that. So anything that's been placed on hold these past few days, you probably won't get a call till next week until we can get all caught up. There are a couple of things we are not allowing to go out at this point. One is the big giant telescopes. They're not going to be going out. We have what we call, it's a collection called Discovery Backpacks. We decided not to have those go out because in those Discovery Backpacks, not only is there books, but there's also little activity things. So there's one on trains, and so there's little trains and train tracks and little people in there. So we've decided, those items won't go out. And board books. That was a tough decision not to have board books go out, but because kids tend to eat them and chew them more so than read them, we felt it was just safer to remove the board books from this pickup service right now. So, but we have everything else. There's movies, there's video games, there's picture books, and our books, of course. The seed library is operating, but you have to request the seeds you want, and we mail those out to you. So we won't be giving out seeds during the pickup, but there is other ways to get that.
How busy has the library been up to this point?
This has really been a learning curve for us. I must say, there's things we're doing virtual that we never would have dreamt of doing, or we would say, this sounds kind of neat, but I doubt anyone will participate. For instance, our book club, we would have book clubs, and we would maybe get 4, 5, 6 people show up. We have 37 people signed up to our book club, and they all participate. I can't believe it. Our weekly challenges, that we have for families and kids, we always have participants. Our genealogy virtual programs, people are doing research now that they're home, and this is another program that's just packed with people. We love it. Our staff are so excited.
For residents in Port Hope, a message posted on the library's Facebook page states the Port Hope Public Library is not ready to swing open the doors on service just yet. The health and safety of staff and the community continue to be the priority right now. The library hopes to soon confirm dates and details for a gradual, phased-in public service. On April 30th, Cameco Corporation announced a $250,000 COVID-19 relief fund to help the communities of Blind River and Northumberland County. The fund would receive applications from charities and not-for-profit organizations. VP of Cameco's Fuel Service Division, Dale Clark, tells Mark Rockburn they received 72 applications seeking more than $1 million in total funding assistance.
I mean, first of all, we're very committed to our communities, and I'm talking about the Blind River area where we operate a refinery, and here in Northumberland County we have a few locations. The connection to our communities is very important to us. We have a lot of employees. We work here, live here, play here, and of course we know that our communities have been suffering. There's a lot of folks in the communities that have very real challenges as a result of the pandemic. We're in a position where we think we can help, and that's what we wanted to do here with this program, is to help make a positive difference in our communities.
What was the criteria for these groups and organizations to be able to submit an application?
So specifically, the fund is meant for any charity or not-for-profit organization in Blind River area that's operating in the Blind River area, or located or doing services here in Northumberland County. And also specifically, the funds are meant to deal with the challenges as a result of COVID-19 as well.
How many groups ended up submitting an application, and how much money was asked for total from those groups?
So we received 72 applications requesting just over $1 million in total. So it's obvious that the demand is very high. There's a lot of people in need. There's a lot of people doing really great work to try and help those people as well. But that application process showed us just how high and how real the need for help is in our communities.
Did that surprise you, Dale, the amount of people and the amount of money asked for?
It did surprise us a little bit. We had some indication. Cameco as an organization did a similar program in Saskatoon and for Saskatchewan area where we're also located. So we had some indication from the application process there that the demand was very, very high. But it is eye-opening just to realize just how significant the demand for help really is in our communities here.
Out of that total, Dale, you're able to narrow it down to 35 groups and organizations. How were you able to narrow it down? And obviously the criteria for that must have been hard to pick one group over another, seeing you had so many groups asking for over $1 million.
Yeah, these were really difficult decisions to make in a lot of ways. I mean, first of all, it's obvious that there really is a lot of wonderful organizations and terrific people that are really working very hard to make a positive difference in our communities. That much is very obvious from this process. But there's a limited amount of funds available. We did have to make some difficult decisions, and so we're looking for ways that we think we can make those dollars have the biggest impact. We're very much trying to look for ways to address some of the urgent needs that we know people have around food and shelter, mental health services, personal protective equipment, for example. There's a broad range, but we're looking for those areas in particular.
So was that what made these 35 stand out above the other ones?
Yeah, in many ways, they address those urgent needs. As I said, those are certainly very difficult decisions, and they're all really impressive people, impressive organizations. But that did, the organizations that we chose, we're very proud to be partnered with and to provide some support. We believe they can really make a big difference in the communities that we operate in.
So what was the reaction, Dale, when these groups were contacted to let them know that they were going to receive this funding?
Yeah, it's been really positive. And everyone that we've spoken to has been really positive, very grateful, of course. We've reached out to all the organizations that submit an application, and really everyone has been very understanding that there is a limited amount of funds, and these organizations and people are very supportive of each other, and supportive of ways that we can help the community. But certainly it's great news. It's great to be able to make a positive difference like this, and we had really good positive feedback from everyone involved.
The end of this show marks the end of COVID-19 Local Impact here on Your TV. It's been a pleasure bringing you weekly and daily updates from the Your TV Peterborough studios. For everyone here, I'm Dan Malta, and we'll see you around.